ask the question?
I asked, can they brag about what they're doing?
That's the question.
That's the setup. Brag.
If they could share what they're proposing to do.
Well, we're the best. I just want to introduce myself. My name is Rashad Media. I'm the Regional State Director for Grow Community. So I get the opportunity to work with these individuals here and being able to provide services in our Waukegan area. And so to brag about what we get a chance to do, I'm going to be here all day because I just love what we do. And I just love the fact that we get the opportunity to work with the Wraparound Center and being able to just provide that resource for our young men here in Waukegan. And so I am going to let my incredible therapists be able just to brag on what they're doing here in the city and what they get to tell me about all the time. So I'm going to let Jaimon have the mic.
Yes. Hello, I am Jaimon Barconia. I am a therapeutic mentor with Grow Community. And real quick, I would just want to share like a quick synopsis of what Grow is and what we're doing out in the community. We are a mental health organization specifically dedicated to supporting boys and men struggling that are from low socioeconomical communities that are struggling with behavioral issues or have impact with the criminal justice system, to provide that support for these boys and men, to help them understand, themselves, to help them grow into strong, responsible men, to help them address those traumas that they've kept buried inside. And so that's where we're here to provide that clinical therapy support through our cognitive behavioral therapy. That is our base, but we also utilize many other modalities as well, such as neurofeedback and solution-focused therapy, and other modalities as well, neurotherapy, other modalities to be able to reach the demographic that we're working with. We also have culturally responsive staff. The Waukegan community, we know, is very diverse. So we have culturally reflective staff to respond to the diverse needs of our boys and men in our community. We also are able to provide that community support component as well. We're able to connect with our guys on a different level. Therapy doesn't have to be face-to-face in an office. Therapy could be conducted at a park. Therapy could be conducted at a nature preserve. We could walk around and participate in community support intervention, and they're able to get that additional support that you can't always provide in an office. That one-on-one mentorship, the resume building, the career exploration, partnering with other community organizations to be able to provide the resources that we can't provide. So overall, what we're doing in Waukegan is we're really providing the support for those who are overlooked, or our young boys and our young men in our community who grow up without fathers, or who grow up and with these struggles that we face. Now, supporting our minority men and low socioeconomical backgrounds is that's our specialty. It's not our limitation, right? Trauma is universal. We're working with everyone in the Waukegan community to be able to provide these services. And then I'll let Elvis introduce himself and kind of add a little bit more as well.
Thank you, sir. Good evening, everybody. Elvis Stillett. I am a therapist with Grow Community. To add to what Jaimon said, we are in Waukegan. We are two individuals who are prepared to provide services to our boys and men, not just in the school system, but the entire community. Something that we are very pleased to know as we are working to establish and formalize this partnership with the Wraparound Services is exactly what we're here for. We're here as an organization to provide a wraparound support to the individuals that we serve. So whether it be in the schools, outside of the schools, we're here to ensure that we're providing those services to the community of Waukegan.
Thank you.
I'm sorry, I would like to add just one more thing real quick. Okay, I'm sorry. The great thing about Grow is the participants are responsive to our services. And that is very important, because therapy has a stigma. Therapy has a taboo. And we're able to break those stigmas and break those barriers by them seeing someone who looks like them be able to communicate what it is. And then yes, I'm sorry.
No, that's okay. Use the mic, Ms. That's the question. You guys make me motivated
Thank you.
with your energy. I feel it. But I'd like to ask, how are you going to attract the individuals that you are going to work with?
Good evening, everyone. Bridget Dodson. So currently GROW they're in some of our middle schools, so there's already that connection, those connections that are made, as well as utilizing the referral system and process through the wraparound. We currently have students waiting, hoping for the approval tonight to refer them to GROW. So we're going to utilize our referral system. They have their outreach already in place. Again, they're already in our schools, in our middle schools. And so we're hoping to, as discussed in my update from this last November, to expand and broaden our scope and reach to support our community.
Ms. Fabian and then Ms. Gonzalez.
So if an individual wanted to self-refer, they would go through the wraparound center
Yes.
essentially?
Yes.
Ms. Gonzalez.